Hello future doctors, welcome back to MedSteps YouTube channel. So today our topic is, we will break down one of the most tested pathology concept, that is common metastasis from general pathology, where mostly cancers love to spread, and we will cover the top sites like primary tumors and clinical clues and how we can decode the image based findings step by step. Everything we are going to discuss in this video. Okay, so before going to video, let me introduce myself. I am Anand Kumar Jana, final year medical student. So without time waste, let's go. So this is, you can see here, this is first aid guide. In first aid guide, we are I am following this first aid guide. So based on this thing, we will discuss. First one, in basic pathophysiology, what is metastasis? Metastasis means, you can see here, metastasis means is the process where cancer spreads from its primary site to distant organs. That means it's one primary site will be there. From that primary site that cancer cells will spread throughout the organs and distant some of the different organs. How this cancer cells is spreading means, most carcinomas spread via lymphatics. Okay, while sarcomas spread hematogenously through the blood. If sarcomas means it will spread through the blood, if carcinomas will spread via lymphatics. This is very important for your USMLE and FMGE and for medical examinations. Okay, but here we have one golden fact, that is 4 carcinomas spread via blood. 4 carcinomas will spread via blood, and that mnemonic will be like 4 carcinomas root hematogenously. That means 4 carcinomas. That 4 carcinomas, we can see first one, 4 means F means follicular thyroid carcinoma. Next one, carcinomas means choriocarcinoma. Next one, root means renal cell carcinoma. Next one, hematogenously, that means hepatocellular carcinoma. So these cancers spread via blood. Okay, or you can call this is hematogenous cancers. Next, these are expectations, they spread like sarcomas. Okay, so now we are going to discuss about some site of metastasis and primary tumor and some important points. First, we are going to see the brain metastasis. In brain metastasis, this is the most common cancers that metastasize to the brain are like lung, then after breast, then after melanoma, then colon and kidneys. Okay, 50% of brain tumors are actually metastasis. 50% of brain tumors are actually metastasis. Okay, and not primary brain tumors, they usually appear as multiple and well circumscribed, found at the gray white matter junctions. Okay, you can see here this in image A. This is CT scan showing, this CT scan shows, you can see here this one and this one and this one. Here I highlighted one thing that we can see, we can call that is multiple rounded well defined lesions with edema. If anything fluid filled means, we can see like hypoechoic thing. So here you can see multiple rounded well differentiated, this image I am talking about, this image. Okay, so in brain we can see some lesions will form with edema. This is a classic brain mets or metastasis. Next one, you can see this image here, this is coronal view of brain. Okay, in this coronal view you can see here, this is enhancing lesions at the junction, like you can see here red arrow is denoting, and this red arrow shows cerebral metastasis. Okay, so this is the about brain metastasis. Next, we are going to discuss about liver. In liver metastasis, liver is the another common site of metastasis. The primary tumor we can see like colon, mostly in colon, then after stomach, then after pancreas. And we have one mnemonic, that is cancer sometimes penetrates to liver. Okay, so this is the colon, then after stomach, then after pancreas. So this is the liver metastasis mnemonic. So why the liver? Because it receives blood, from the GI tract via the portal vein. So it's a filtration trap. That's why most commonly we can see that that colon, stomach and pancreas cancer, because of these things most commonly we can see in liver metastasis. So if you are seeing this image, liver and lung are the most common sites of metastasis after the regional lymph nodes. Okay. So here if you are seeing this image, here you can see this is the CT scan. In CT scan, the red arrows, it's denoting the it's showing like hypodense metastatic liver lesions. Okay. So this is CT scan image. If you are seeing here, if you are seeing this image, this is gross pathology. If you are cutting the liver into section, and you can see here multiple pale yellow nodules, like classic metastatic pattern. We can call this thing classic metastatic pattern. Okay. So these are the things will comes in liver metastasis. Next will be bone metastasis. In bone metastasis, most commonly, if for FMGE and for medical examinations, for PG medical examinations, this is the most favorite question they can ask from here. Common primary cancers that go to bone, that is prostate, breast, kidney, thyroid and lung. That mnemonic will be like painful bones kill the lungs. So this is the mnemonic. So this is the common primary cancers that go to the bone. Okay. Bone metastasis commonly affect the axial skeleton. In axial skeleton we can see like spine, pelvis and ribs. Okay. So then this bone metastasis can be lytic. This bone metastasis is primary bone tumor, example like multiple myeloma, and this predilection for axial skeleton we already discussed, and bone metastasis can be lytic. Lytic means destructive, breakdown. We can see that things in thyroid, kidney and non-small cell lung cancer or lung. Okay. Next one, blastic. Blastic means bone formation. Example you can see like prostate and small cell lung cancer. Next one, mixed. In mixed, example breast cancer. Okay. So these are the bone metastasis. If you see in this image, you can see here. You can see here this is X-ray image. In this X-ray image, this red arrow is pointing to a blastic lesion. This is the blastic lesion in the proximal humerus. It's like classic for prostate cancer. Okay. Next one you can see here, this is gross bone. In this gross bone structure, it's like you can see mixed lesions. You can see here, you can appreciate easily. I am highlighting this thing. This is mixed lesions, like black arrow, it's denoting lytic, and the red will be like blastic. Okay. Next you can see here, this is nuclear scan. In this nuclear scan you can see here the red arrows, it's showing like bone hotspots, like multiple skeletal metastasis. Okay. So these are the first we discussed about brain metastasis, liver metastasis, then after bone metastasis. So clinically what are the things important? The patient is present with if patient have like brain metastasis, the patient is present with neurological signs, unknown lung cancer. Okay. Then you have to think about brain metastasis. If patient have liver metastasis, you can see the patient will comes with this type of sign and symptoms like jaundice and colon cancer. If patient come to you like bone pain and like lower back pain, prostate cancer, then you have to think about blastic bone metastasis. If patient have a hypercalcemia and thyroid and renal cell cancer, then you have to think about lytic bone metastasis. Okay. So here multiple ring enhancing brain lesions means we have to think about metastasis and not gliomas. Okay, this is this important question for imaging based questions. Next, multiple level nodules if you are seeing means then you have to suspect metastasis and primary hepatocellular carcinoma. Bone scan hotspots, you can, if you are seeing means metastatic skeletal spread. Okay, so these are the things, always link symptoms to likely metastasis. So this is the main important things. I am giving little recap with these images. You can see in brain like most commonly you can see like lung, breast, melanoma and colon, then after kidney. In liver, most prone to get cancer is colon, then after stomach, then after pancreas. It's like spreading things. The cancer sometimes penetrates to liver also. Next you can see here bone. In bone we can see like prostate, breast, then after kidney, thyroid, lung. Some painful bones kills the lungs, and lytic means like lytic metastasis means lung, kidney and thyroid we can see, and blastic metastasis, bone metastasis means you can see prostate, small cell lungs, carcinoma, and mixed will be like breast. Okay, so you can now you can I hope you can confidently identify common metastatic patterns, and based on image I explained, and how you can find the images and how you can interpret everything I explained in this video. Okay, I hope this video is helpful for you. If it's really helping you, then if you didn't subscribe my channel, like, share and subscribe. If you have any doubts, you can ask me in comment section. Okay, so we will meet in our next topic in general pathology. We will meet in our next video. Okay, till that time, take care, bye bye, and don't forget to subscribe, like, share and comment. Okay, bye bye.